Before we begin today's episode, we want to provide a trigger warning. In today's conversation, we'll be discussing topics related to mental health, which may include anxiety, depression, trauma, and other potentially distressing experiences. If you or someone you know is struggling, we encourage you to reach out to a mental health professional and/or use available crisis resources in your area. We'll also include helpful links and numbers in the show notes. Now, on to the episode.
You're holding the hand of someone taking their last breath, and you haven't eaten in 8 hours. And your shift ended an hour ago. And tomorrow, you'll do it all over again. Sound familiar?
Taking care of others doesn't mean that you're sacrificing taking care of yourself, or at least it shouldn't. And today we are going to encourage you to finally put yourself and your mental health at the top of the priority list, because it's really not an option. We want your well-being to be prioritized. Yep. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hearst Review's got your back. Listen close, stay on track.
Nurses are expected to be calm under pressure, comforting in chaos, and resilient in the face of trauma. But where does all of that pressure go? Because if you think about it, when you're feeling emotionally drained and anxious and running on fumes, well, you're not alone. Ashley, today I really want to talk about why we need to take mental health from the back burner and put it at the top of our care plan. How would you rate your mental health today on a scale of 1 to 10?
I'd probably say a 6 because, you just sometimes have those days where it's just like nothing goes right, but you're here and you feel pretty good, but then there's this pressure and there's all these things on your to-do list. And so today I'd probably rate it a 6.
Okay, well, we'll take that.
Yeah.
We're going into the weekend, so maybe it'll bump up there.
For sure.
Check in with yourself right now. How would you rate your mental health score, from 1 being we need to call in some reinforcements and really get some help, 10 being you're on a beach, not a care in the world, life is great? Just kind of do a daily check-in with yourself and see where you're at. Because as we kind of dive into mental health, I think it's important just to kind of be more comfortable and familiar with where you stand and what a normal range for yourself is before we get into, signs and symptoms and the care plan and everything going forward. So Ashley, if we kind of put a visual to mental well-being, the saying, like, you can't pour from an empty cup.
Oh, yeah.
And I think that that's a really good one when it comes to talking about nurses or, healthcare profession and mental health, because you learned about it in school.
Yeah.
You know all about mental health.
Yep.
You know what to recognize, how to treat it. And you do that for your patients. Do you also do that for yourself?
I think we're the world's worst. A lot of times we know we don't. And I'll just speak for myself. No, I don't always do what I need to do for my mental health. And I love, the saying about you can't pour from an empty cup. But what's funny is that we try all the time to. And nurses, not just nurses, but a lot of other people do all the time. And you're pouring from an empty cup, but what you have to think about is, well, what's coming out? If there's nothing in there, there's nothing left, and I keep trying to pour, what is really coming out? And so what kind of result am I getting from continuing this way? Am I actually harming myself or harming someone else in the process of trying to continue to pour while I'm empty? And so, I think sometimes we have to think about the fact that there will be times where we just have to, show up and continue to do. But then we have to do that check-in and say, okay, what result am I getting from continuing to try to do this?
Yeah, and you can either, to get that cup back full, pour into yourself, allow others to pour into you, and just kind of take that maybe like little bit of respite and say, you know what? I need to recharge these batteries. I got to go find some tap water somewhere and get this thing fuller. That way I can tap in. Because when it comes to nursing, especially, I think taking care of yourself as a nurse doesn't make you a weaker nurse. It makes you a more sustainable nurse and a safer nurse, as you had mentioned.
For sure. I think one of the things that anybody involved with the betterment of the nursing profession, one of the things that we want is we want to keep nurses in nursing for as long as, they would like to be in nursing. We want them to retire as a nurse versus quit. And a lot of times there are a lot of issues that go beyond just personal mental health. There's lots of things that, apply to that and cause that. But we want nurses to stay in nursing for as long as they would like to and as long as they, can. And if we're not taking care of ourselves with our mental health, that's not going to happen.
And staying in the profession, we talk a lot and we hear it all the time, nursing burnout.
Oh, yeah.
And I think mental health and allowing yourself as a nurse to kind of get to that point to where I can't take this anymore. It's too stressful. I have so much anxiety. I'm, have PTSD, depression, whatever it may be. I'm exhausted all the time. My cup has been empty for years.
Yeah.
I think that's when this burnout really happens.
For sure.
So I want to talk a little bit about some statistics when it comes to mental health in the nursing profession. Then we're going to get into signs and symptoms. We're going to create a treatment plan, and we're going to provide our listeners with resources when they start to feel that pressure kind of really building up. Well, this is the release valve on that pressure cooker. We're going to let it out because we want, as Ashley just said, you to have a wonderful, lifelong, happy career in nursing. We love statistics. We love looking at numbers and hard facts. So we've got our stats kind of pulled up over here. And what I find interesting when it comes to this mental health nursing burnout is that the National Academy of Medicine actually labeled nurse burnout as a public health crisis.
And isn't that wild that it was specifically nurse burnout and just not burnout, period, or any other profession in the medical field, it was specifically nurse burnout. And I think that that's, one, very interesting, but two, a little scary. And I get it. I get why it was specifically nurses. I mean, of most people in the nursing profession, we're the ones at the bedside the most consistently, spending the most time with the patient consistently. And unfortunately, typically the one that takes the hit when something happens, even if it was not directly the nurse's fault, it's the nurse's fault. And so it's just wild to me that it's so bad that it had to be addressed in that way.
Yeah. And when I hear the term public health crisis, my mind goes to epidemic, pandemic, wow, okay, this is crisis management, right? So we're going to manage this crisis. When it comes to the public health crisis of nurse burnout, we ask for help. We find, a really good support team. We realize when that pressure release valve needs to be released, and we listen to podcasts, and we're okay with saying, my mental health score, I'm at a 2. I need help. I cannot let this drop any lower. Maybe you're at a 0. Maybe you're at a 1. Maybe you're at a 9 or 10, but it's only a matter of time before it fluctuates, because it is a pendulum.
It is. And I think it would be totally unfair not to even address this, but we have to, is that I feel one of the issues is that we focus so much on the nurse fixing their own burnout versus supplying resources and supplying safe staffing ratios and supplying appropriate time off, required time off, or, addressing, issues with violence in the workplace. Like, there's so many things that contribute to nurse burnout that don't have anything to do with personal mental health. It's in the environment.
You're absolutely right. The environment that you're in really impacts your mental, physical well-being, emotional well-being.
Yeah.
I think about, taking a vacation.
Oh, yeah.
I don't have as many responsibilities or laundry to do or, meals to plan.
Yeah.
And my mental health score always goes up. Then I
Yeah.
come home. I've got to unpack. I've got to do the laundry. I've got to go to the grocery store. I've got work tomorrow. I got to catch up on emails. I'm, boom, 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 boom. And it's amazing how quickly within a 12 to 24 hour time span, sometimes even less, that mental health score can really change. And the same probably happens, driving into the hospital.
Yeah.
When you're entering those environments, as you mentioned, you get a message, oh, we're short-staffed today.
Yeah. Or I'm pulling you. You're being pulled from your, normal floor, and you're now having to go into a situation where you're unsure. And, there's not enough nurses to cover the patients that are on the floor. And it's a hostile work environment. And that, that's on us. That's each other. Those situations where we don't take care of each other too. And so I just feel like, if you had anything going on personally, now that's just adding to it. And it's just so much easier to get burnout when that happens. And I think, we also have to think about the fact that we're sometimes walking into situations where we have no idea what's going on. And then, especially if you come out of that situation and it's not the outcome that you wanted, the outcome the family wanted, the outcome the patient wanted, you're told, oh, you're not supposed to talk about it, right? Like you're not supposed to sit around with your coworkers and have conversations about that unless it's directly about the care that's being provided at the time. So you said, where do you put that pressure? Like, where does that pressure go? Well, sometimes there's not provided resources for you for things like that. And so it's, that's where you start to see people getting in trouble. They're breaking and violating HIPAA by going out for breakfast or dinner with their coworkers and they're talking about something they shouldn't be talking about in a public place. Or they turn to the internet, social media, TikTok. We've seen a lot of situations where people are utilizing social media as therapy. And in some of those situations, they're violating HIPAA or they're violating their hospital's social media policy by doing that. We've seen situations where that's happening too. And it's again, like, where does that go? Are there provided resources that are available and that the nurse does not have to pay for out of their own pocket, right? Because, a lot of times if people are having to pay for therapy out of their own pocket, they're not going to do it.
Yeah.
And in a safe environment.
Then it might create a financial burden, which then just goes into a lower mental health score. And then it's just a cyclical environment.
For sure.
Since we're on the topic of therapy, there's also statistics out there that many nurses feel guilty for acknowledging the fact that, they are emotionally fatigued. Why? Well, the common answer that they've gotten in these studies is it's because nurses, are supposed to be the strong ones. They're supposed to be the ones, providing care and helping others. So there's even like this guilt factor that comes into it, which is why 57% of nurses are reporting that they are feeling emotionally exhausted. And 31% that they're likely to leave the profession in the next 6 months.
Yeah.
Due to mental strain and, this burnout topic. Right. And these are all according to the American Nurses Foundation. Yeah. They did a survey recently in 2023. And really, as I was reading through this document and some of the numbers, I was just absolutely mind blown.
Yeah.
So now that we have a better understanding of the severity of the mental health, public health crisis within the nursing world, we're not going to tell you anything that you don't probably already know and that you haven't studied already, but because we're going to come up with a care plan, we need to identify signs and symptoms.
That's right.
Sometimes we don't even realize how we feel until it's too late.
Yeah.
Or we'll kind of shrug off like, yeah, I'm tired. Yeah, I'm, feeling heightened blood pressure and maybe heart rate when I walk into my employer. It's normal.
Yeah.
Well, no, it's not normal. These are some early warning signs that really we want you to be paying attention to.
Yep. I think we talked about this in a previous episode where, there might be times where there's something happening and you kind of have to just, brush it to the side or flush it for a minute. And the issue is that we never come back and sit with it. Like this is a perfect example of that where they go, oh, that's normal. Or you flushed it and you never came back to sit with it and go, okay, what did this mean? What could this mean? What am I experiencing? What's going on? And so, like you said, those feelings of anxiety or pressure, the moment that you get ready to walk into work, getting the Sunday scaries, anything like that, that's something that needs to be addressed.
Yeah. And am I experiencing these symptoms in different environments
Yes.
too? Bringing it all back to, these environmental factors
Right.
play a part in this personal feeling that you're experiencing. I just mentioned one, one sign or symptom could be not feeling rested or not going through all of your REM cycles and you're constantly feeling exhausted and it's time to take a nap.
Right.
Maybe another one is that increased heart rate or blood pressure when you're walking into certain environments. What are other signs and symptoms that people can be on the lookout for when it comes to maybe some mental health red flags?
Yeah. I think one that's really big is detachment or emotional unavailability, especially if you're a person that's a feeler, like you constantly kind of feel things and then all of a sudden you just feel numb, don't really feel anything. That could be a really big red flag. Skipping meals, skipping activities, things that normally bring you joy, they don't bring you joy anymore. You don't want to do those things anymore. Skipping bathroom breaks, like saying, I'm just not going to go to the bathroom. And I know as a nurse that's one of those things that we do anyway. We'll hold our bladder. But if you just start to notice that just intentionally skipping, that's a part of your self-care, right? But just intentionally skipping things like that, that's something to always watch for too.
And I'm sure sometimes, there's days where you're just in the thick of it and you do skip a meal.
Yeah.
Kind of take these signs and symptoms and weigh them and say, again, ask yourself, how often is this happening?
Right.
Am I doing it intentionally,
Right.
unintentionally?
Because, some of these things are things that could happen with a reason behind it.
Yeah.
Like you had the opportunity to do it and I just don't want to get up.
Yeah.
I just don't have the energy to get up out of the bed, or I just don't want to get up off the couch and I don't want to make myself, or I can't make myself, then that's a really big red flag.
And some things can be like triggering
For sure.
events. For me, sometimes I'll look at my husband and I'm like, I just need to cry. I don't know why. I need to cry. I feel like I haven't cried in a while.
Yeah.
And I believe, it's a good release.
Right.
So I'll either, put on a really like sad song or watch a sad movie because that does it for me. And it's just kind of saying, okay, I have been kind of bottling some emotions and I just need to let them out in a very healthy environment before it gets triggered. And then I feel like I don't have control.
Exactly. And just to note, that I wasn't laughing at you. I was laughing at the fact that what you said was so relatable, right? Because there's going to probably be somebody that's listening or somebodies that are listening that go, oh my gosh, you do that too? And like, that was totally relatable to me because I'm like, oh, Sarah, I didn't know that you do the same thing. I do the same thing too because you need to, sometimes those releases need to happen in safe environments where you're like, somebody's not going to judge me. They know me well enough to know that this is something that I need and it, helps me and I'm going to be better after it's over. And so, I just thought that was so relatable. That's why I laughed because I was like, oh my gosh, I'm not alone.
Yeah.
Right?
And some people don't get it. Like he looks at me and he's like, what do you mean you haven't cried in, 19 days? You're keeping track? And I was like, no, I'm not keeping track. I'm like, it's just been a while. I just need to let it out.
Right.
And why? I don't know.
It just works. It helps.
Sometimes I know. And then other times it's like, I can't pinpoint it, but I just need a healthy little outlet over here.
Yeah.
And that's okay too.
Yep.
So that's my kind of strategy that I use. Why? I don't know. It works for me. Find what works for you. And maybe some of these like practical strategies for prioritizing your mental health will give you some inspiration if you're like, I don't really know where to start.
Yep.
This could be a short process. It could be a long process. It could really just kind of depend on your personal journey. But you don't necessarily need, a whole day off to start your healing process. You really just need these 3 things. You need intention, you need support, and you just need to make a few small shifts.
Yep.
And we're going to start letting that pressure ease on up.
Yep.
So one tip is to set those emotional boundaries. We talked about this last week.
Yep.
When it comes to, saying no.
Mm-hmm.
Or I think you even said there was a line like, I can't take this on right now.
Mm-hmm.
Sometimes it doesn't always have to be no, but you can alter whatever that version is.
Right.
Beyond, saying no or kind of rerouting it to not now, not yet, maybe later. What are other, emotional boundaries, like things to consider when it comes to nurses?
Well, I think one of the things that we have to be careful with is tone. So like, when you're, like you said, like maybe not saying, well, not right now, because sometimes that can be, misunderstood. Like they take that personally, like it was me. You want to still have compassion and be compassionate when you're, trying to release emotionally. And so I think one really good strategy here is maybe saying, if you don't mind, like using that terminology, because most of the time people don't mind, especially when you ask, say, if you don't mind, can I just have just a minute, and then like excuse yourself to the break room.
And you don't want to, again, going back to those studies that were done, you don't want to be perceived as weak.
Right.
That was the number one comment that they received from nurses. It's not weak. It takes a lot of strength to be able to say, I need to take care of myself.
Right, because you have to consider the alternative. And as an educator, I've had this conversation with students plenty of times. You do have to consider the alternative. Is what harm are you going to do trying to push through without that? It is so brave and strong of you to say I need help, to say I need a minute and take it, versus, oh, I'm okay. Oh, I'll be fine. Will you? Will you be fine if you don't sit with that and address that and, process that? And so, addressing,
If you push through, it's just kind of like a domino chain. If you push through, and we know that leads to more unsafe behavior and something happens, then you're going to feel the guilt and the shame and the embarrassment. Right. And what is that going to do then?
None.
What, are you going to push through again?
Yeah.
Because you want to right a wrong?
Right.
No, it's okay to set those emotional boundaries. So
right.
that's a great strategy to take in place. But when it comes to PTO, you don't always have to explain your reason as to why. If you don't feel comfortable or if you don't have that relationship with your preceptor or, whoever approves that time off, you don't have to give an explanation as to why. You can just say, okay, man, I'm looking at my schedule here. I know things are getting heavy. I haven't had time to pour back into my bucket or to allow people to pour into me.
Yep.
And I'm looking at this date and I'm working that day, but it gives me enough notice to let people know I'm just going to put in my PTO request and I'm going to treat that as a personal mental health day.
Yep.
You don't have to share that with anybody if you don't feel comfortable.
Right. That's a day for you. And I love the fact that, people who utilize their PTO well, they're not thinking about, well, how much more of it do I have? And, do I want to not use it and like save it towards retirement? A lot of places don't even allow you to do that anymore. But utilize those days. And I love the fact that you said without explanation, because they're personal. They're personal days off, personal time off. And so, put it in Don't explain. Go do whatever it is you need to do.
Whatever they feel most comfortable with.
That's
it's
right.
totally acceptable.
Yep.
Another wonderful strategy is to seek support. Here's the key word, proactively.
Mhm.
It's okay if we get to the point where retroactively we've got to kind of
Yeah.
roll it back and get some support, but really seeking it proactively. Maybe your employer has an EAP, an employee assistance program, to where there are benefits for you to utilize.
Yep. Where they can get that therapy. It's a part of their benefits package. They do not have to pay extra for it. Take advantage of it. You know, like anything like that.
Yeah. Mental health days. Sure. For some places, it may be just putting in PTO. There may be some other employers out there that have, these are your PTO. These are your, paid holidays. And your employer may also have, you're allowed 2 mental health days a year. I'm seeing this a lot in schools.
Yes.
Which I think is awesome that they are bringing this into a younger environment to say, sometimes we don't have great days mentally, and that's a great time for you to step back. So I'm happy to see slowly that other employers are also implementing that. And if not, that's what PTO is for.
Absolutely.
But I get it. When it comes to taking time off, sometimes people have to be strategic with that. So if that isn't an option for you at this moment, then let's talk about a different strategy. This could be building, we'll call it micro recovery into your shift. And maybe it's sneaking into that bathroom because we know you got to pee because you haven't peed in who knows how many hours. And you're probably not drinking enough water. So run to the bathroom. Just take a minute. Take 3 minutes. Focus yourself, close your eyes, do a, little meditation, say your prayer, do some breathing exercises, whatever it is for you to have that micro recovery moment. It can bump you up a couple levels. It can help you kind of reset.
Right. And I think one of the things that it's okay to acknowledge is that in a 12-hour shift, there is no way you are working straight for those 12 hours. There's just no way that that's happening. And so if you need to, add those moments in, you've still got things, other things to do that are not where you're, physically at the bedside taking care of the patient right then and there. So take those moments. If you absolutely need to, please do, because there are times where those might be the only breaks you get. There's no way for you to work all of the 12 hours.
Are you allowed within the 12 hours? So I threw out the obvious one to me, which is kind of like going into the bathroom. I know that there's break rooms. What about outside and getting fresh air? Are you allowed to leave?
Most of the time, as long as you're not actually leaving, if you work in a hospital, as long as you're not leaving campus or hospital property. They call it campus, like a school. But as long as you're not leaving campus property and you've given a report to the nurses that are still on the unit, you've announced that you're stepping off the unit, your patients have been given to someone else, they're in their care for now, and you're still reachable, because typically most nurses have a little cell phone that we carry around that's not a personal one, it's a unit phone. Then most places do allow that. I would always recommend that you research your own hospital's policies about that, because one of the worst things that you could do is, think that that's okay and it's not. But I personally feel like that is one of the best strategies to refocus, is to get out, like go outside and stand in the air, in the sun. And even if it's dark, if you work overnight, safely, go out, get some air, come back.
Those are some quick tips from our side and strategies, but we would love to hear if there's one maybe unique to you or that somebody shared with you. If you feel comfortable enough to write in to Nursing Navigator at HurstReview.com or sending us a DM, maybe it's a tip that we can share on a follow-up episode or post it on our social media, because that's what this platform is here for, right? We want to help other nurses navigate their nursing journey. those were some tips. Let's get into some resources very quickly in case you're looking for more. And again, we don't want to just breeze by any of these. We'll link them all in the show notes and in the episode description. If you're looking for something that might be nurse specific, there is a website called nursegroups.org, and it is a peer group of nurses. It's designed for nurses to, just provide kind of that safe space outlet. And then, of course, there's also NAMI as well, the National Alliance on Mental Illness. And they have a website, nami.org. There's lots of books and podcasts and, YouTube videos, creators, TikToks, social media. Check the resources that they are recommending, but find one that kind of resonates with you and listen.
There are apps available if you prefer that method, things like Headspace, Calm. Those are really good options. There are others. Again, lots of opportunities and options out there for you. Just make sure that you're utilizing something that you feel really works well for you. And, again, if you feel like something, you try it out and it's not working well, go find something else. There's plenty of other opportunities out there for you. And apps are a great way to improve your mental health.
Yeah. We've been using this 1 to 10 range.
Yeah.
If you are at a 2 or a 1 or pushing a 0, there is a suicide and crisis lifeline that, you can call or you can text. It's completely free. It's 24/7. They have therapists, they have healthcare professionals, they have some law enforcement, ambulance, EMTs. Please utilize that. The number is 988. And again, you can call it, you can text it. We don't want it to get to the point to where you didn't know that there was a resource out there and, something really unfortunate happens.
Right.
None of these are, sponsored or we're getting paid to promote this. There's lots of resources out there, and we just want you to maybe have a starting point if you're looking for some additional resources.
And I think one thing to add here, and just to make a note, is that I know that sometimes people feel weird about like self-help or like self-care resources. I think the problem is that a lot of people feel weird about them, or like they say, I don't like that self-helpy stuff, is because they read it or they see it, listen to it, and then they don't apply it. It's the application piece that is where you really get the most benefit and the most help. And so make sure that whatever you are utilizing, you apply the strategies and the tips that they give you, because the application is where you're really going to see the most benefit.
Mm-hmm. And tweak it.
Yeah.
If it doesn't work for you, because it's so black and white, find that gray area and tweak it for whatever works.
Yeah.
Actually, I think the one thing that we really want our listeners to take away as we wrap up this episode is that their patients deserve a nurse who is present, who is calm, who is patient, who is alert and aware. But all of that being said, you as the nurse, as an individual, as a mom, as a sister, as a uncle, as a friend, you deserve that too. Yeah. So prioritizing your mental health is not selfish by any means. It's necessary.
Right.
So if this episode resonated with you, we encourage you to share it with others, because that's really the best thing that you can do in order to help others is to, let them know that they're not alone and that you do care for them and you do want them to be prioritizing their mental health to avoid getting to that point of burnout or worse.
Right.
You got this. We're rooting for you. We're here for you. We want you to stay grounded, stay kind to yourself. And until next time, future nurses,
current nurses,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hearst Review.
Guiding you through from school to the floor. Nursing nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigators here.